Hi, I'm Annie. I am a PhD nursing student at the University of Minnesota, and today I am going to throw you a little pitch about using MAXQDA for your mixed method study. Now, MAXQDA is simply a computer software program that is really designed for qualitative analysis, but it also has some pretty powerful tools that we can use for a mixed method study. So we'll just quickly review a couple of those tools that we can use, and I'll give you some good explanation about why I think MAXQDA is a great choice for your mixed method study. So to provide a little bit of background and a little bit of context for my mixed method study, I wanted to share with all of you what the research question was that I posed for my study. The research question that I was exploring is the following. Do patient-reported areas for desired improvement following critical illness differ in those with low quality of life versus those with normal quality of life at the time of post-ICU clinic follow-up? So just keep this research question in mind as we further explore the use of MAXQDA for mixed methods research. I've been working with my specific data set for quite a few years at this point, and I've always had, so many questions about my data, but specifically, one of the biggest questions that I have always had about the data that we have gathered from our patients is regarding this qualitative piece that they share with us. So we ask our patients to rate their quality of life, and that's how we know if they have a normal or a low quality of life. And after they tell us what their quality of life is on a scale that goes from 0 to 100, we ask an immediate follow-up question that asks them to tell us if they could think of one or two things that they would really like to see improve to help improve their quality of life. What would that be? And then we simply record their answers. So we get some really nice qualitative data from our patients that way. I have always asked myself, I wonder if the patients with a low quality of life are telling us something different than those with a normal quality of life. I just never quite knew how to figure that out. That is until, of course, I started working with MAXQDA. Now, MAXQDA has several tools within the Mixed Methods tab that I walk through on a step-by-step basis in our YouTube tutorial, but some really powerful tools where we can take our qualitative data and our quantitative data and integrate them to start answering some of these questions that we have. So on the screen here, I am sharing with you what is a segment matrix. And so the segment matrix is something that you commonly see in mixed methods studies when you're looking at the literature and you're reading other people's manuscripts. You see these segment matrices. And this is something that MAXQDA can be really helpful in producing for you. So as you can see here, I have my table and it is split between low quality of life and normal quality of life respondents, and then specifically what they said. So it gives you that really great visual as to what are patients telling us between these two groups, and it starts giving you some type of sense of are they telling us something different, or is there something unique with this group versus that group? So the segment matrix can be a really great step in helping you visualize both of your data as you start integrating them together. The next tool that I wanted to share with you is the cross-tab function in our Mixed Methods tab within MAXQDA. So the cross-tab really allows you to quantize your qualitative data. So as you can see on the screen here, my snapshot of our cross-tab, you can see our qualitative codes that are on the side there, and they are quantitized. So you can start seeing what percentage of patients were telling us that strength was something that they wanted to see improve, or what percentage of patients told us that they just needed a little bit more time. And so the cross-tab function of MAXQDA is really helpful in quantitizing your qualitative data and starting to answer these questions. So when people ask you, so what do most of your patients say? What would they like to see get better? We can quickly look at this tab or this table and say, well, it looks like most people are telling us that they want to get stronger. So this is a really nice way to be able to integrate your qualitative and your quantitative data together within MAXQDA. So that's it. That wraps up my pitch for MAXQDA and why I feel like it's a really powerful tool for those of us to use that are conducting mixed method studies. Hopefully some of the examples that I provided you today spark a little bit interest. And if you are pursuing some mixed methods research, just remember MAXQDA can be a powerful tool to have in your back pocket.